Hi, Sauk County. This is Tremanisha Stewart, your new health officer, as well as your newly transitioned incident commander for the COVID-19 response. This is our weekly update for February 11th, 2021. Today we have a short agenda, but no doubt meaningful. Today I have with us Jody Molitor, Siobhan Allen, and Jesse Phelan. So we have newly updated guidance from the CDC regarding vaccinated persons that have been exposed to someone with COVID-19. Those that have been vaccinated are not required to quarantine as long as you have been fully vaccinated. So if it has been more than 2 weeks following your second dose of your current vaccine, then you would not have to quarantine. If you're fully vaccinated within the last 3 months, you would also not have to quarantine if you were in contact with someone that had COVID-19. You also would not have to quarantine if you remain asymptomatic during that exposure period. This, again, is brand new guidance from the CDC. So for more information, you can visit the website that is linked in the chat below. At this time, I will pass it off to Jesse Phelan.
Thanks, Tremanisha. Just thought we would do a little discussion today about the new variants and what you might need to know about those. So a variant is a new strain of the SARS-CoV-2, otherwise known as COVID virus, with a gene mutation that makes it a little bit different from the initial strain that had been identified. The variant that is called B.1.1.7 has now been identified in Wisconsin. Now, just so you are all aware, mutations among viruses are very common. This one appears to be a little bit more transmissible, meaning that it spreads a little easier to folks than some of the other strains. But currently, it does not seem to be causing any more severe illness or increasing the risk of death to people who come down with this. We can slow mutations by slowing replication of the virus. This increased transmissibility means that it is even more important that we all do our part to stop the spread. Continue to stay home, wear your mask, wash your hands, and physically distance from other people. Excuse me. Current tests are detecting the new variant. Someone who is infected with the new variant will test positive if tested with current testing, like those administered at our free community test sites. The test, however, will not tell you what strain of the virus you have. Studies of the efficacy of current tests against new variants are ongoing. To detect the new strains, DHS and its lab partners are collaborating with the CDC to conduct strain surveillance and identify strains through whole genome sequencing of a small portion of positive tests. Medical providers are asked to notify DHS of individuals who have tested positive for the PCR test and may have traveled to another country in the last 30 days, been in close contact with a positive person who recently traveled to another country, if they have prolonged illness, or they have a recurrence, meaning like a second infection of COVID-19. Suspected repeat infection patients who receive certain antibody therapies and any SARS-CoV-2 infection in an individual who has received a COVID vaccine. Current vaccines appear to be successful with the variants. It's unlikely that mutations occurring in this short period of time would change the virus enough so the vaccine would be ineffective. These studies are ongoing. And while we wait for enough vaccine to vaccinate the general population, we need to continue to use all the tools in our toolkit to slow the spread of COVID-19. Again, this is wearing your mask, washing hands, social distancing, and then testing when you are exposed to someone with COVID-19 or you yourself become symptomatic. Disease investigation and contact tracing does help us ensure that people are isolated or quarantined to prevent further spread. So make sure that if you get a call, you pick up the phone and do the investigation interview with our disease investigators. And again, just answer that call. Disease investigation and contact tracing, with new cases decreasing, we have the capacity to contact and follow up with all of our cases. We are able to also now resume contact tracing, which again, if you have not already heard this, those have been passed off many times to the state contact tracing team. So don't be surprised or alarmed if you get a call from somebody from the Department of Health Services or DHS. We have sent some of them our contacts. We are maintaining household contacts and those who attend or work at a school. So again, please answer the call. Timely disease investigation and contact tracing really does help us slow the spread of COVID-19. And then we will turn it over to Jody for our testing reminders.
Okay, thank you. Hi, everybody. I just wanted to give you some testing updates and reminders. We do have testing throughout our county most days of the week. There have been some updates to our times due to the cold weather. This Wednesday in Merrimack, it will only be running from 4:30 to 6:30. And Sauk Prairie Healthcare has also shortened their hours a little, so 1 to 4 p.m. on Thursday for their testing. Otherwise, Mondays in Spring Green, Tuesdays in Reedsburg, and also Fridays at the Circus World parking lot. Baraboo Fire and EMS runs that one for us. Just a reminder that we do recommend testing for everyone that has any COVID symptoms, anyone who has had close contact with someone who tested positive for COVID, and people who have regular exposure to many people, such as grocery store workers, waitresses and waiters, those type of people. So to find a free testing site in Sauk County, we'll let you go on our link that is shown here, but it's co.sauk.wi.us/publichealth/free COVID testing information. So again, just remember to check our website for updates due to the cold weather. And with that, I will turn it over to Jessie for vaccine updates.
Okay, COVID vaccination update. At this time, there is not a lot new from last week, but just to recap, the current eligible population are frontline healthcare personnel, residents and staff of skilled nursing and long-term care facilities, fire and police and correctional staff, and then adults who are age 65 and older. Eligible populations, which will start sometime after March 1st, will include education and child care, individuals enrolled in Medicaid long-term care programs, some public-facing essential workers, non-frontline healthcare essential personnel, city staff, and residents in congregate living. And then just a reminder that we have our vaccine site locator map on our website, where you can get more information about all the current vaccination sites in Sauk County. Reminders about keeping up to date on our vaccine rollout, signing up for the Nixle alerts, texting your zip code to 888-777. Again, keeping an eye on our webpage, and then also our Instagram and Facebook pages will have these updates as well.
Thank you, Jessie, for all of those updates. We really appreciate it. As a reminder, if you have any questions, you can email those to covid19@saukcountywi.gov, and we might answer your question on one of our upcoming video recordings. And next, I will move into our COVID-19 data update and our COVID trends. Okay, so we're actually going to start our data update today with the vaccines data. And so Wisconsin DHS has just today released their new vaccine dashboard. So we've embedded that on the data hub for you. And this new dashboard shares a lot more demographic information about the people who have been vaccinated. So we get to see the age, gender, race, and ethnicity data, as well as the vaccines over time and the percentage of residents who have received at least one dose. So I'll give you a quick overview of this. If you click on a county, then you can see the filtered data for that particular county. So you can see that just over 13% of Sauk County residents have received at least one dose of vaccine. When you look at our 65 and over age group, it's just over 40% have received at least one dose. So that new data is good to track for us. You can also filter this data to see the percentages who have completed the vaccine series. So these are the individuals that have received both doses of the current vaccines. and see that information shared there. So this information is updated by DHS. I believe that they're planning on updating that weekly. So check back here for that as well. Also on the vaccine data page, I do have the vaccination site locator map embedded, so it'll automatically pop up there. It does take it a little bit to load, so please be patient with it. And then if you haven't already watched the COVID-19 vaccines press conference that we did with some of our local healthcare providers, that is here as well. Really recommend that you watch that. It has a lot of great information and answers a lot of really common questions that people have about the vaccines. Okay, we'll move on to the rest of our data overview. So to give a snapshot here of where we are today, there have been 5,164 confirmed cases and 240 probable cases. When we look at our trends over time, you see that we are continuing that really steady decrease in new cases. We'll get a little bit more in detail in our 14-day data on more about that decrease, but the most recent 7 days, we're averaging about 7 cases a day. So it is really encouraging to see those new cases per day decreasing. So we'll hop on over to the 14-day trends. And there have been a couple of changes in the status of some of our metrics. So the first and most notable change is that our influenza-like activity, which was elevated for last week's report, has moved back down to the low to the green. And the other metric that changed that's really concerning for us is that our community spread was in the yellow for a couple of weeks. It is now back into the red. So when we look at the last 14 days, we can select Sauk County from this here, you'll see that we are still at a high case activity level. So while we are making a lot of progress and decreasing those new cases per day, we do still have a high case burden of COVID in Sauk County. So it is important for us to continue those preventive practices, especially now that we're starting to identify some of these variants in the state of Wisconsin. So the masking, physical distancing, staying home when you can, remembering to wash your hands and disinfect commonly touched surfaces, those are all going to be really important to slow the spread, especially with these new variants that are more transmissible. Another thing with our data here in the past 14 days is our percent positivity. It's really good. We're maintaining in the green, so in the low category here. Over the last 7 days, that was 3.4%. I do also break down this data over the whole 14-day period to be consistent. So over the 14-day period, it was 3.5%. And we like to see that be below this 5% baseline. Couple other notes about our testing is that while our number of tests conducted remained in the green, we are doing less testing. You know, as I've mentioned before, in November, we were doing well over 500 tests a day for an average. In December, it was well over 400 tests a day. Most recently, we're averaging just over 300 tests a day. And in particular, in the last 14-day period, when we compare the first 7 days to the last 7 days, our testing numbers decreased by 28%. Now, we recognize that a lot of this is due to 2 of our community testing sites being closed due to winter weather, but it is still concerning to us that the testing numbers are decreasing, especially when we look at our community spread. So our community spread over the last 14-day period is 40%. Now, we are able to interview and get more complete data on our community spread with the decrease in cases. Our capacity is increased and we are able to contact and interview more of our cases. So in the last 14 days, we actually interviewed 88% of the cases. But what this is telling us is that more people don't know where they could have gotten COVID. They are not connected to a source case. That is telling us that there is cases out there that we don't know about that are not isolating, that are spreading COVID, most likely don't even know it because this can be spread before somebody has symptoms or people can have asymptomatic cases. So people can unknowingly be spreading COVID. So this is why it's really important that if you have any symptoms, even one symptom, We have many, many, many times where we talk to people and they're like, I thought it was just allergies. I just had a little sniffle. Please go get tested so that you can know if it is just a little sniffle, and so that we can stop the spread instead of having cases out there unknowingly and unintentionally spreading this virus. So please, if you have even just one little sniffle, go get tested. If you've been exposed or if you think you've been exposed, please go get tested. These are the tools that are in our toolkit right now for us to be able to slow the spread of this virus. Kind of along those same lines, if you do get a call from a disease investigator, please answer it. Our disease investigation timeliness has stayed in the yellow, so 78% of those cases were contacted and completed a disease investigation interview within 24 hours. Overall, 88% of new cases had an interview recorded, and 96% of those cases had a contact attempt recorded. So what we're really finding is that it is taking us longer to contact new cases, have those new cases call us back, and complete that disease investigation process. Our staff are really friendly. Please call them back and talk to them. Through that process, our disease investigation staff can also help by providing information and resources to help you during isolation and quarantine. So please, let's use all of the tools that are available in our toolkit to slow the spread of that. That does include disease investigation and contact tracing and quarantine and isolation. So we thank you for helping us with that, so that until we have enough vaccine available, that we can continue to slow the spread. Other data, our lab timeliness, want to mention that too, is continuing to be in the green. We're continuing to get improved lab time on the time it takes from when that test is collected to when we get the results. And we're getting a majority of those within 2 days. So it is much, much, much better than it was late last fall and into November and December. That lab time is greatly improved. And as a reminder, on the Data Hub, we do have additional demographic data for our probable cases and the confirmed cases. And a quick little reminder about some of the probable case data. So somebody is counted as a probable case when they test positive using an antigen test method, so one of the rapid tests, or if they have symptoms of COVID-19 and known exposure to a positive case, or if COVID-19 is listed on a death certificate without a positive PCR test. So they could have had a positive antigen test for that. And the increase, and the reason why we're sharing this information, is because of the increased availability of rapid testing. And so you can see that once that became available, we're starting to see that increase in those cases. So that's why that information is available for you there. And it has also happened where somebody will test positive on an antigen test, and so they'll be counted as a probable case. And this number may fluctuate because they may receive a follow-up PCR test, and then that probable case would then become a confirmed case. So if you see on our daily data updates a negative number in the probable cases, it is most likely because one of those probable cases had a follow-up PCR test that was positive and they became a confirmed case. So thank you very much for watching our update call today. If you have any questions about the data on the Data Hub or COVID questions in general, please email them to covid19@saukcountywi.gov, and we may even feature your question on an upcoming one of our video recordings. Thank you, everybody, and stay healthy.